structure, a boat shaped structure. When you on the top, if you have fascia is covering, that is called flexor retinaculum. Now it is looking like a tunnel. So through this tunnel, some structures will be tunnel. This tunnel is called carpal tunnel. Why it is called carpal tunnel? Because the carpal bones are forming this tunnel. It's called carpal tunnel. Once the flexor retinaculum covers, it is looking like a tunnel. So what are the tendons which are going into this carpal tunnel? Carpal tunnel syndrome. If the tendons are called flexor tendons. We got 4 tendons. You can see this 4 blue color picture, and then 4 above and 4 below. These tendons are called flexor digitorum superficialis. This is called flexor digitorum profundus. Flexor digitorum superficialis and flexor digitorum profundus. Profund means what? Profund means deep. Okay. Superficially, there are 4 tendons. Deep, we have 4 tendons. On the top, on the flexor retinaculum, or we can say attached to this flexor retinaculum, we can see an yellow-shaped structure. What is the yellow structure called? Median nerve. So the median nerve will be running almost attached to the flexor retinaculum. This is the median nerve. Okay. We also have flexor pollicis longus, that will be radialis. This is also 2 muscles. So what is a nerve? If we have a, this is a tunnel, this is a very closed tunnel. If we have a tunnel, how the tunnel will enlarge? If there is an accumulation of fluid, the tunnel will get enlarged. So if this tunnel is getting enlarged, will it hit on this nerve? So that nerve which will be affected in a carpal tunnel is called carpal tunnel syndrome. That nerve is median nerve. So median nerve will be always affected if we have any collection of fluid in this tunnel. So that nerve is called median nerve. You can see in this picture also, this is one more picture to show the carpal tunnel. So here also you can see that the flexor tendons are coming here. Okay. So this is a hand, this is a thumb. Okay. You can have the nail. So thenar muscles. This is called hypothenar muscles. You can see there is median nerve. This 1.5 finger is supplied by ulnar nerve. 1.5 fingers is supplied by ulnar nerve. Ulnar nerve is usually not damaged or not compressed in case of because it is going in a separate canal called Guyon's canal. What is the name of the canal? Guyon's canal is for ulnar nerve. Guyon's canal. So what is the nerve which is going in the carpal tunnel? That is median nerve. Median nerve will be compressed and the person will have tingling sensation and paresthesia on the lateral aspect of the hand. It's common in IT individuals because they are using more of they are using more of this wrist joint when using the mouse. So that tunnel is called carpal tunnel syndrome. It can happen in pregnant women also because of the fluid collection in the carpal tunnel. Okay. Now we will go back to the question. So what is the nerve that will be affected in this condition? It is not the radial artery. It is not the ulnar nerve. It is not the radial. The option should be radial nerve. So what is the nerve that will be affected? That is the median nerve. Okay. Now one more question can come. A person complains of pain in the dorsum of the hand following an injury due to a fall. Due to a fall from the height in RTA. What is that? Road traffic accident. A person has fallen down and he is having a pain on the dorsum of the hand. This part is called the palmar aspect of hand. This is called the dorsum of the hand. After this, the person is having a pain on this region. And on examination, the doctor is finding that there is a pain on the anatomical snuff box. The key word here is the anatomical snuff box. On palpation, there is a pain on the anatomical snuff box. What is the structure that will be involved in this condition? Scaphoid fracture, hamate fracture, radius fracture, median nerve injury. It can be anything. So first we should know what is anatomical snuff box. Okay. When you put your hand like this, you will feel that there is a small, you can see a tendon here. Between the tendons, can you see a small fossa over there? That fossa is called anatomical snuff box. Okay, this fossa, what you see here, between in the thumb, when you can say abduct the thumb, when you abduct the thumb or extend, abduction and extension thumb, you can see a small fossa over this part that is called the anatomical snuff box. Over the base of the anatomical snuff box, or we can say over the floor of the anatomical snuff box, we got a carpal bone that is called scaphoid. So scaphoid is present on the scaphoid is a carpal bone which is present on the floor of the anatomical stuff box. So on examination, the doctor is palpating this region and the person is having a pain or tenderness is there. So scaphoid tenderness is a sign of, or anatomical snuff box tenderness is a sign of scaphoid fracture. So the question can be anatomical snuff box tenderness. So what is the name of the fracture? What is the bone that will be injured? Scaphoid bone will be injured, especially on the neck. The scaphoid will be like a boat-shaped bone. The scaphoid is like this. This is called the neck of the scaphoid. This will go for a fracture. Okay. Now, in other terms, what are the boundaries of this anatomical snuff box? They can ask you this. Okay. We got three muscles here: abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis. Okay. So this muscle, we got two tendon here. Can I say this one? This is called abductor pollicis longus, which is stopping here. One muscle will stop here. Okay. So this is called stepladder incision. So one muscle which is stopping in the base of the metatarsal, that is called abductor pollicis longus. The second muscle will stop in the base of this, or in the proximal phalanx, that is called extensor pollicis brevis. The muscle which is there on the other side is called extensor pollicis longus. Okay. So abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. These two will go together. Which one? Abductor pollicis longus and extensor pollicis brevis will go together on the lateral part. This extensor pollicis longus will run on the medial part. Okay. So this is the boundary of this. So what is the boundary of this? We got abductor pollicis longus, extensor pollicis longus and extensor pollicis brevis. These two tendons will go together. On the other side, we got a long tendon will go separately. Okay, this is the boundary of this box here. This is called anatomical snuff box. What is there in the base of this is the scaphoid bone. What is the artery that will be injured? The radial artery will be injured. Radial artery will be present on the floor. So if you palpate your own anatomical snuff box, you will feel an artery. What is that artery? That is a radial artery. Okay. The bone injured in anatomical snuff box is scaphoid bone. The fracture. Okay. So we got in lower limb. We will see some questions. Maybe we will continue with that and some important topics in the lower limb. We'll see. So high yield topics for FMGE in case of lower limb, they are gluteal muscles, nerve supply of these muscles, Trendelenburg test, and common peroneal injury. We'll see two parts today: gluteal muscles and Trendelenburg test. Now we got a question here. So what is the question? Which nerve supplies the gluteus medius muscle? Okay. Nerve supply of gluteus muscles. Which nerve supplies the gluteus medius muscle? What the options? We got a superior gluteal nerve, inferior gluteal nerve, nerve to quadratus femoris, nerve to obturatus. Okay. One more question. Okay. Which nerve supplies the gluteus maximus muscle? This is a recent question. Superior gluteal, inferior gluteal, nerve to quadratus femoris, or obturatus. Superior gemellus. Okay. Now to understand this, we can see this diagram. Hope the diagram is visible for you. Okay. Now this diagram are drawn to show the muscles. Okay. So what are the muscles in the gluteal region? So gluteal region, main muscle which is present like this, the entire muscle which is present, that is called gluteus maximus. Gluteus maximus. It is the first muscle, or it is undercover. Now if you take out this gluteus maximus, these are the structures. So what you are seeing is not gluteus maximus. Gluteus maximus will be covering the entirely. Okay, the gluteus maximus will cover entirely. If you take out the gluteus maximus, you will see some more structure. that muscles are called, this is called gluteus medius. The second muscle is called, third muscle is called gluteus minimus. So gluteus maximus is covering entirely. If you take out the gluteus maximus, you will see on the top a muscle called gluteus medius, then gluteus minimus. The smallest is called the gluteus minimus. A bigger one, a middle one, and a smaller one. Gluteus maximus, medius, and minimus. Now, what is the nerve supply of this muscle? Gluteus maximus is supplied by inferior gluteal nerve. Okay, the key muscle of this region is called piriformis. What you are seeing here is the piriformis. This is called the piriformis muscle. Now, if you see the piriformis, there will be one nerve which will be going above, there will be one nerve which will go below. Above the piriformis, this is piriformis. Above the piriformis, the nerve is called superior gluteal nerve. Below the piriformis, the nerve is called inferior gluteal nerve. So, what is the key muscle of gluteal region? Piriformis. Above the piriformis, the nerve which is coming is called superior gluteal nerve. Below the piriformis, the nerve coming is called inferior gluteal nerve. So, which nerve is supplying the gluteus maximus? This fellow, which is coming down the supply. So, inferior gluteal nerve supply only one muscle. Inferior gluteal nerve supply only one muscle, that is called gluteus maximus. Then who will supply the medius and minimus? So, superior gluteal nerve will supply medius. You can see this is the superior gluteal nerve. It is supplying the medius also, it is supplying the minimus also. So, both will be supplied by the same nerve, that is gluteus. Medius and minimus are supplied by superior gluteal. So, you got the concept correct. There is a piriformis muscle. Above that, superior gluteal nerve is coming. Below that, inferior gluteal nerve is coming. Superior gluteal nerve will supply medius and minimus. The inferior gluteal nerve will supply the bigger muscle, that is the maximus. We'll keep aside the gluteal muscles, that first gluteal muscles. Now we got one more group here. What is piriformis? That is a key muscle. The piriformis is supplied by a dorsal rami of S2 to S3, sometimes S4. So it is coming from the sacrum. This is a sacral bone. The sacral nerve itself will supply. It is not supplied by other things. The sacral nerve S2 S3 will supply the piriformis muscle. So piriformis is from sacral nerves. Now we got one more group here, that is called superior gamellae. Inferior gemellus, obturator internus, then quadratus femoris. Quadratus femoris. So we can divide the gluteal muscles into a gluteal group and this group. In between that, one key fellow is there. That fellow is the piriformis. Okay, so what is this group? This is the superior gamellae, inferior gamellae, obturator internus, quadratus femoris. Everything is there in the name. So what I have given the blue color, this is called the superior gemellus. This is called the inferior gemellus. We got a foramen here. In the pelvis, you must have seen a foramen near the ischium. This foramen is called obturator foramen. A muscle which is starting from here is called obturator internus. So this obturator internus coming. Now you can see from the ischial tuberosity to the, this is a femur bone. This is a femur bone. A muscle is coming from the ischial tuberosity to the femur bone. It is quadrangular shape. This is a quadrangular shape. What is the name of the muscle? This is called quadratus femoris. Quadratus femoris. Because it's going to the femur, the muscle is called quadratus femoris. So we got superior gamellae, inferior gamellae. Between the two, we got a muscle that's called obturator internus and quadratus femoris. Now we'll come to the nerve supply. Now see here, which is nearby to this, we got only two nerves. We don't have a gamellae nerve. We have only nerve to obturator internus. This fellow is there, and nerve to quadratus femoris. We don't have a gamellae nerve. So nerve to obturator internus, just apply logic. The nerve to obturator internus will supply, obviously, obturator internus and superior gamelli. Nerve to quadratus femoris will supply quadratus femoris and inferior gamelli. Okay, you see here, this is the nerve to quadratus femoris. It is supplying the quadratus femoris and this blue color muscle. That blue color is the inferior gamelli. Nerve to obturator internus will supply obturator internus and superior gamelli. Okay, if you know this nerve supply, it's enough. So, nerve supply of gluteal muscles I will cover again. Gluteus maximus is supplied by inferior gluteal nerve. Okay, so above the piriformis, the key muscle, we got superior gluteal nerve and inferior gluteal nerve, and gluteus maximus is supplied by the inferior gluteal nerve. Okay, we got gluteal medius muscle, gluteus minimus muscle. They are supplied by the superior gluteal nerve. The piriformis is the key muscle. The key muscle is piriformis. Piriformis is nearby the sacrum, so it is supplied by sacral nerves S2 and S3. We got muscles here. How many muscles are there? 4 muscles are there. Superior gamelli, inferior gamelli, obturator internus and quadratus femoris. So, nerve to obturator internus is supplying the obturator internus and superior gamelli. Nerve to quadratus femoris will supply quadratus femoris and inferior gamelli. These are the gluteal muscles and its nerve supply. Okay. Now, if you go back to the question, you can see that now we can answer. So, which nerve supply the gluteus medius muscle? Which nerve will supply gluteus medius muscle? Superior nerve to quadratus femoris or this one? It is supplied by the which nerve? That is the inferior gluteal nerve. So, inferior gluteal nerve will supply the gluteus maximus. Now, which nerve supplies this superior gemellus muscle? Superior gemellus is nearby to which nerve? As I have shown the diagram, it is superior gemellus muscle is supplying the is nearby to the obturator internus. So, it is a nerve to obturator internus will supply the superior gemellus. Okay. So, this is a diagram to show all the muscles. Now, we will see one more topic that is called commonly asked topic, that is Trendelenburg test. Which of the following nerve injury is a positive Trendelenburg test? And gluteus maximus. So, which muscle gives a positive Trendelenburg test? Okay. The options are confusing. Gluteus. Once we understand the topic, you can understand better. Okay. Or which muscle is tested by this? Okay. Now, what is Trendelenburg test? Now, I have given a diagram here. Okay. Now, imagine if you are standing on your foot. Okay. I couldn't draw this diagram. Now, you will stand like this. Okay. Now, if I lift my left foot, that means I am lifting like this. Okay. I am standing here. I am lifting my left foot. Pardon for the diagram. Okay. So, what I am doing, I am lifting this from the ground. I am lifting this left foot from the ground. Can you imagine this is the knee part and this is foot. This is taken away from the ground. What will happen to my pelvis? This is the pelvis. Will my pelvis tilt? It will not tilt. Okay. The pelvis is held in position like this. Usually we don't do like this, no, when we stand. So that part, that stabilization of pelvis is done by a muscle. What is a muscle? That muscle we saw now. What is that muscle? Gluteus medius and minimus. So two muscles are there, gluteus medius and minimus. They are coming from this gluteal region and going to this femur. Gluteus medius and minimus are coming from here and going to the femur. So that muscle will be helping in stabilizing this pelvis. So that muscle will always help in stabilizing. If we don't have, now imagine a scenario. Gluteus medius and minimus are paralyzed. What is the nerve supply of gluteus medius and minimus? We saw in the previous one, it is by the superior gluteal nerve. So superior gluteal nerve, if there is an injury, what will happen? This muscle is paralyzed. Now this muscle cannot support this part of the pelvis. Now if this person lift his left leg, what will happen? This pelvis will tilt like this. The pelvis will tilt. If there is a pelvis tilt on lifting the legs or during that part is called Trendelenburg sign. Okay, this is normal, this is abnormal, this is normal, this is abnormal. Okay, so normally the gluteus medius and minimus will keep the pelvis in horizontal position during the lifting of legs. Now if we do that part, or if there is a gluteal nerve injury, which gluteal nerve? Superior gluteal nerve injury, the pelvis will tilt like this because there is no support here. No, these muscles are paralyzed muscles, they cannot support. So what will happen? There will be tilting. Okay, so that is called superior gluteal nerve injury supplying the gluteus medius and minimus. This test is called what? Trendelenburg test positive. Trendelenburg test is positive. Okay, positive means paralysis is there. Negative means there is no paralysis. Tested in the superior gluteal nerve, or which nerve is tested? It is the superior gluteal nerve palsy is tested. Which nerve is tested? That is nerve. And what is the muscle? Should be here. Gluteus medius and minimus is the answer. It is not maximus and medius, it is not maximus and minimus, it is not superior gamma and inferior gamma. So which muscle is tested in case of a positive Trendelenburg injury? Medius and minimus. We are testing the medius and minimus. If they ask you, the question should be nerve. Which nerve is tested? It is the superior gluteal nerve. It is not the inferior gluteal nerve, it's not the tibial nerve, it is the common peroneal. So identify the Trendelenburg test and Trendelenburg sign. Now a muscle, which nerve supplies the popliteus muscle? So popliteus is a question which is asked here. What is popliteus muscle? Now on the posterior aspect of this is a tibia, sorry, this is a femur. So this is a femur, this is tibia, this is fibula. You can see one muscle there on the popliteal fossa. We got a triangular, diamond-shaped fossa on the posterior aspect, that is called popliteal fossa. Muscle here which is starting from the femur and going to the tibia, which is there in the diamond-shaped popliteal fossa, that is called popliteus muscle. So popliteus muscle is supplied by what nerve? The nerve is called tibial nerve. The tibial nerve. So what is tibial nerve? We have a sciatic nerve which is coming on the back. It will come to the popliteal fossa or above itself. It will divide into two nerves, a tibial component and a common peroneal component. Okay, or tibial nerve and common peroneal nerve. Sciatic nerve will divide into a tibial nerve and common peroneal nerve. So where it happens on the popliteal fossa. Some persons it will happen above the popliteal fossa also. The division can happen on the popliteal fossa or proximal to the popliteal fossa. Obviously, it will divide into two nerves. The sciatic nerve is dividing into tibial nerve and common peroneal nerve. The tibial nerve will supply the popliteus muscle. Okay, the tibial nerve will supply the here. If we have a fracture on the neck of fibula, now I am giving a question. A fracture on the neck of fibula, a person coming with the pain on the lateral aspect of the upper end of. Okay, so if we have a fracture here on the neck of fibula, which nerve will be getting injured? This nerve is called common peroneal nerve. So common peroneal nerve will injure on the neck of fibula fracture. On neck of fibula fracture, which nerve will be getting injured? Common fibular nerve will be injured. So other name is common peroneal and color. Some books will common peroneal. Nowadays, most of the books are giving common fibular. Okay. So either option can be common peroneal nerve palsy or common fibular nerve palsy. So fibular fracture nerve injury is common peroneal nerve injury. I gave an idea about the upper limb muscles. This idea can be applied to the lower limb also. Anterior thigh, most of the muscles are supplied by femoral nerve. So compartment wise, if you divide, The thigh compartments, we divide them into thigh muscles. This is the femur. We divide into 3 compartments. Okay. This is anterior compartment, a posterior compartment, a medial compartment. In arm, I told you only 2 compartments, no? Anterior compartment and posterior compartment. But in case of thigh region, this is a cut section of the thigh region. This is a femur. We have an anterior compartment, we have a posterior compartment, we have a medial compartment. So what is the nerve of this anterior compartment? What is the nerve that is present here? So anterior thigh, the nerve is called femoral nerve. Most of the muscles are supplied by femoral nerve. On the posterior part of thigh, what is the nerve? It is a sciatic nerve. The sciatic nerve, just now I told you it is divided into tibial and common peroneal. Especially the sciatic nerve branches itself will supply this. Okay. Now, what is the nerve of the medial compartment of thigh? It's called obturator nerve. Supply most of this except one muscle, that is adductor magnus. Okay, adductor magnus has 2 parts. One is the hamstring part, another is the adductor part. The hamstring part will be supplied by the tibial nerve, but other parts will be supplied by obturator. Now, on the leg, how can we divide? This I told you for the thigh region. Now, this is a cut section of the leg. What will be the nerve? What will be the bones here? We got tibia and fibula. Okay. Now, how many compartments are there? Here, it is divided into an anterior compartment, a posterior compartment, and a lateral compartment. So, it's slightly, you note the change here. In the thigh region, we got a medial compartment. In the leg region, we got a lateral compartment. So, what is the nerve of this anterior compartment of leg? The nerve of the anterior compartment of leg is called, what is the nerve? Anterior tibial nerve. So, this nerve is called anterior tibial nerve. Posterior compartment, we got a nerve called posterior tibial nerve. Tomorrow, I will tell you the other name for this. But the anterior tibial nerve and posterior tibial nerve. Some books will say tibial nerve itself. Anterior tibial nerve, other name is called tibial nerve. Now, this nerve which is coming on the lateral aspect is called superficial peroneal nerve. So, all the muscles on the lateral compartment is supplied by a nerve called superficial peroneal nerve. So, if you know the compartment, we can tell about the nerve supply of these muscles. Okay. So, in this part, we have just completed the high yield topics. I have not covered the entire topic. I have covered the high yield topics of upper